Okay, everybody. It's lovely to be here today, and thank you to the organisers for asking me to do this talk. What I'm going to talk about actually is probably going to tie in very well with what Deirdre has been covering as well, because it's all really about self-management. And self-management really is, it's about, and Dr. Merrigan talked about a little bit this morning, that idea of taking control. So it's about taking control of the things that you can take control of in terms of maybe managing some of the symptoms and some of the consequences really of managing your cancer and post-cancer. So I suppose what I was going to talk about this morning a little bit, and I'm conscious that I'm between you and your lunch, just talking about some of the persistent symptoms that people experience after cancer treatment, and they would mainly consist, I suppose, what a lot of the research talking to people who've been through all types of cancer, they talk about the things that tend to have difficulty kind of post-treatment and that linger would be things like fatigue, pain, disturbances around sleep, and anxiety and stress. So I'm going to just, I suppose, really, each of those can cause enormous issues for people, and there are professionals out there like myself and Deirdre, physiotherapists, dietitians, psychologists, that would help you to manage each of these in turn. And so really what I'm going to do this morning is give you very much a whistle-stop tour and just some suggestions. And I suppose from an OT point of view, occupational therapy, we typically see people who are experiencing fatigue. So I'm going to probably maybe focus on that. And also, I suppose, the knock-on effect of other areas. And again, some strategies. And then also I'd like to talk to you about a programme that we've developed within the discipline of occupational therapy in Trinity College, which is called Optimal. And that's a self-management programme around giving people some strategies and knowledge and skills around managing some of these persistent difficulties post-cancer. So... and really these are quite common across all of the cancers, and this morning obviously we're looking at ovarian cancer, but a lot of people with gynecological cancers as a group would talk about a lot of kind of the physical and the psychological impact related to not just the cancer itself, but also the treatments. And I think probably in the last 10 years, there's been so many advances made in terms of cancer diagnosis and cancer treatment that there's a lot more emphasis now being put on and a recognition that there are a lot of difficulties for people post-cancer. And a lot of our participants in our research would say that, you know, kind of they're finished their treatment and they're kind of told to kind of go off now, we've cured you, you're fine, and get on with your life. And a lot of people are saying, that's fine, but we don't know what to do. You know, we need a bit of guidance. What should I do? What should I focus on? The diet, the physical activity, how much can I do? And people actually say, you know, they feel bad then, you know, I should be grateful that I've been, you know, treated and cured, and therefore I shouldn't be looking like I'm needing more from the system. I should move on and let the people who are newly diagnosed come in and have the professionals' time. But I think now there's recognition that people do need support. You can't just leave people to go off to their own devices. And this is reflected a lot. There's been a national cancer strategy, and I don't know if you've had a look at this, that was launched last year. And so there's a whole section in that now that's saying that, you know, survivorship, there's issues associated with that, and we need to be putting time and effort and resources into dealing with those. And from a symptom, I suppose, cluster perspective, the research is really showing again that the kind of the cluster that causes a lot of distress for people is those kind of fatigue, sleep disturbance, pain and depression, and that they are the issues that are interfering with kind of getting back on that kind of your usual routine, getting maybe back to work, going back to school, college, and getting back into those things you were doing before you had your cancer. So I'm going to talk a little bit, I suppose, probably focus a bit more on the fatigue, because it's often a kind of a neglected symptom, if you like, and people talk about, I have this problem, fatigue, and it's hard to explain it to family or friends because everybody thinks I look so well. God, you look great, aren't you? And I can see the nods. And, you must be back on track again. And why don't you come and do this? Why can't you come back to work full time? Why can't you pick the kids up? Why can't you kind of do all the things you were doing? Because you seem to you're looking so good. So really, people are saying it's underreported, it's undertreated, and it's under-recognised. And again, I think it's that thing. There's no pill to take when you're having a lot of fatigue. So it's really about how do you manage it in your day-to-day life. It's up to 80% of people who have had chemotherapy or radiation will say that they're experiencing fatigue. So that's a lot of people, and so it's really indicative that there is assistance needed, and it can't be just kind of wiped under the carpet. You're fine, off you go. And of those 80%, nearly half of those have moderate to severe fatigue, which really stops them from doing the things they want to do. And that even 2 years, 3 years, 5 years down the line, almost a third of people continue to report fatigue. So I'm not saying everybody gets it, because everybody is very different, but it is a major problem for quite a percentage of people. And it has a knock-on effect. Fatigue can impact on your mood. If you're tired and you can't do things, you're going to feel down and depressed. You're going to feel a bit kind of, why can't I do things? You blame yourself. It can cause cognitive difficulties. We all know when we're tired, it's harder to concentrate and it's harder to remember things. So again, if you're going back to work and you're trying to go back into full-time demanding jobs or full-time college, it can be hard to kind of focus from a cognitive perspective. A lot of people call it the chemo brain. You've probably heard of that. And obviously chemotherapy and some of the medications can have an impact on your cognition. Pain will cause fatigue, and fatigue will make your pain feel worse. You get more stressed because you can't do the things that you're supposed to do. That causes emotional difficulties. People tell us that when they're tired, they react. They have more emotional and negative reaction to things. When you're tired, it's more difficult to cope with things. So when things happen in your day-to-day life that before there would have been small things and you wouldn't even have noticed them, you just would have got onto them. People say that they do have more of an impact from a kind of an anxiety stress perspective. So really what we're finding is that if you can manage the fatigue and that a lot of these other things are easier to manage or put more in perspective. Now, it doesn't mean to say sometimes you might need professional help. Again, having a cancer diagnosis can have a huge impact on your life. And sometimes you need more. It's not just about managing fatigue. So don't always think everything is related to my fatigue either, and that's where I suppose getting the advice, professional help will help you to just kind of, be able to decide, is it fatigue or is it something else that I need a bit more help with? Again, these are just some of our research participants who've talked about the impact of those persistent symptoms. They talk about a trap of fatigue and that it tends to be like a cycle, that once you get caught up in it, it's hard to kind of stop and get out of that kind of trap. If you're tired, you get unfit, you stop going outside and you start putting on weight, which is really a lot of what Deirdre was saying as well. And so it's about kind of picking that apart and managing each of those, addressing the fatigue and balancing that with things like diet, activity. Another one of our participants talked about kind of, was going back to work, but going back to work was kind of taking all of her energy, and she didn't have anything left for other things, and felt that, yes, again, it's great I'm back at work, but that has consequences for my family and the other things that I'd like to be able to do. Another person was talking about that cognitive impact of fatigue, and saying, kind of wasn't sure, just knew that she wasn't as sharp as she would have been before. And this was somebody with kind of a high level demanding job, and so it kind of had that woozy feeling, and feeling like my brain was made of wool, that I kind of found it hard to kind of problem solve, make decisions. And again, that feeling of, your mind starts to go mad, and the whole fear, is this my cancer back again? I'm not coping. Is it, I can't, I'm not physically active. I'm just constantly tired. But a lot of people would say they kind of felt like that before they got their diagnosis. So they kind of associate the two, and there is always that fear of the reoccurrence. So how do you manage fatigue? It's not rocket science. It's really about kind of, I suppose, stopping and kind of looking at what are the things I can change. Are there ways that I can manage my energy more efficiently? If I have a limited amount of energy, how do I make the most of that? Resting when necessary. And again, Diarmuid, as Diarmuid was saying, you don't want to give up everything and rest. That kind of was the view maybe 10, 15 years ago. But it's about combining resting with also being active and getting your exercise, and staying active through lots of different ways. There's the exercise, but also going for walks, going out with friends. All of those things are really important that you maintain doing that. Sleep hygiene, we hear a lot more now about sleep hygiene. It's a kind of funny term, I always think, but it's important to think about your sleep habits and routines, and I'll talk a little bit about those. Acknowledging anxiety and stress. Don't try to kind of bury your head in the sand. Look at the things that are causing stressors, and how do I manage those? Kind of, again, I'll give you, it'll be a whistle-stop tour, but just some strategies to think about, to take away today around ways of managing. And Diarmuid has talked about the diet and how important that is. How do I make the most of my energy? There's kind of a well-known kind of the 4 principles, the 4 P's of energy management: planning, pacing, positioning, prioritizing. Planning, really thinking about kind of that diary. What do I need to do over the course of a day or a week? What are some big events maybe that are coming up that I need to just think about? How do I be ready for those? How can I make the most of those? And they're particularly important in terms of maybe a big work event, a big meeting, a conference. So you need to think about your energy expenditure. It may be a social event, like communions, weddings, a party, meeting a friend for dinner. You want to be able to enjoy that occasion. So again, planning ahead and thinking about how do I make sure that I'm prepared for that. Maybe you need to kind of take things easy before the event and also after the event. And don't be hard on yourself. Acknowledge that these things do take a lot of energy. Pacing yourself, again, over the course of the day or your week, and that's where the diary or making lists can help. What do I need to do? So you pace things around your high energy times. Maybe if you find you've more energy and you're fresher in the morning, you'll do kind of important things at that time of the day. So pacing over a period of time. Prioritizing activities. I think some of us are guilty around thinking, oh, I've got to do everything. Nobody can do it as well as I can. And when you have something like cancer, or you have even other chronic conditions, like sometimes people with Parkinson's disease or multiple sclerosis, again, they're not going to be able to do everything. So it's about, what are you going to let go? What are you going to kind of let other people do? we're not the only people that have to do these things. And delegation is good. And sometimes family members don't like to hear the word delegation. But, again, and often your family want to do things, and there's nothing as good as being given something concrete to do that you're helping the person. So again, think about family, friends, maybe colleagues, co-workers that might be able to take some of the load and do the things that are important. And then positioning. That's really important in terms of the whole area of ergonomics, in terms of how you do activities. Looking at your workstation, looking at how you work in the kitchen. Are there more energy efficient ways? I can't get into it all today, but just to know that is important. And if you aren't in a kind of an optimal position in work, you are going to be more fatigued. So again, this is somewhere where physiotherapy, occupational therapists can help you to do that, and maybe even do a visit to your work site to maybe advise you on some ways to be more energy efficient in the workplace. And resting, as I say, a lot of people have said to me, I don't like to rest because I think I'm giving in to my fatigue. And it's really not giving in if you take a rest. It really is about taking control of that fatigue. So you decide when you're going to take the rest, and resting before you really reach that stage of exhaustion. Because again, we probably tend to, I'll push on, I'll just do another 10 minutes, I'll do another half hour. I want to get this thing done, I don't want to come back to it later today. But probably it's going to take you longer in the long run to do it. So you're better off if you can take a short rest, 10 minutes, 20 minutes, whatever it is. You'll find that ultimate rest period for you. You work that out for yourself. The sleep hygiene, the whole thing about just thinking about when your sleep and how you sleep, and maybe some of the habits that we all do before we go to bed. It's not particularly good to be having kind of those stronger drinks. We all know this, but we don't always do it. So again, if you are having difficulty sleeping, just think about, well, what's my routine before I go to bed and before I go to sleep? Are there kind of healthier things that I could do to help me sleep a bit better? Your bed, again, it's basic, but think about the mattress. Is it comfortable? How long have I had it? Do I need a new mattress? The temperature of the room is important. As I say, having heavy meals, drinking a lot of coffee or alcohol before bed does affect, it does cause sleep disturbance. Water intake is going to make you want to get up during the night. Exercise, again, before, again, not too soon before you go to bed, because again, we all know what exercise kind of gives us that high. If you go to bed straight after it, it can lead to difficulty sleeping. So again, just thinking about the timing of that. Again, getting out every day, getting some sunlight. All of these things will help sleep. And then the final thing there is making sure that you use your bedroom only for sleeping. And again, the iPads, the iPhones, checking your phone, being on Twitter before you go to bed, when you're in bed, is all going to obviously affect your sleep in that it gets you, you're kind of focusing on that, it works you up, you become more alert. Moving on then, maybe with stress, and again, the more stressed you are, the more fatigued you are. And so you can look at managing your energy, but sometimes it's about, dealing with that stressor and whatever it is. And the first thing in terms of trying to deal with it is recognizing it. What are the things that are causing me the most stress? And as I say, sometimes it's just about writing those down, making the list, and maybe ordering them in terms of the ones causing most stress, and then start with that. And how do you deal with that? And again, and I know some of these things are easier said than done. Try not to procrastinate about things. If something is causing a problem, try and think about, well, how do I deal with that problem? How can I address it? Don't kind of think, oh, well, let's pretend that isn't happening, because it will come back around at some point. So trying to deal with it head on is better in the long run. Talk things through, family, friends is important. It really does help to relieve stress. Professional help, again, your healthcare providers, psychologists, they're not always available. There's a shortage of psychologists, but certainly to look at your primary care team, your GP. They can make referrals to health professionals in the community that can help you to manage some of these things. Diet, exercise, sometimes just taking, looking at things like natural chamomile tea, warm milk. Some of and they're readily available in the community. Yoga, Tai Chi, massage, all of those can help in terms of reducing stress. And there are there's now a lot of these activities easily available and locally available in people's community. There's probably a lot more going on than we realise. So it's just a matter of tapping into those and taking advantage of those and using those as relaxation strategies. So I suppose maybe just leading on to the programme, the optimal programme that we developed in Trinity, and kind of really how did we come about developing that programme and the need for that. And really, like I was saying to you earlier, people were saying kind of, when you're finished, and these were people who participated in the programme, and they were saying, like, you've so many questions, you've so many symptoms, you're worrying about things, but you don't know where to go, you don't know how to move forward. Another participant was talking about that when he went home, he didn't feel like his former self, but felt pressure that, he had to get back into kind of that role that he was in before his cancer. And went from an old woman, went from a young to an older woman overnight. And then the idea that when you're on your own, and really living from one appointment to another to try and get some answers about what I should and can do. And then this idea of not being allowed to complain. And I suppose really the whole movement really around that kind of whole cancer survivorship, one of the areas there's been a lot of focus on is the whole idea of self-management. And how do you take control? How do you manage some of those difficulties and lifestyle changes? And again, I suppose Dr. Merrigan was talking about that this morning, that's one of the most things that you can actually control. You can't always change your genes and where you've come from, but you can actually change what you're doing and your health behaviours. And so self-management then really looks at kind of how do you take charge of the things that you can? How do you take charge of the medical side of your condition? How do you take charge in terms of the emotional impact and the emotional reactions? And then how do you take charge of your cancer and how it impacts on your everyday activities? And in order to be kind of effective around managing all those three aspects, you need to kind of be able to develop the skills. And the skills that will help you to manage those is that you're more effective in terms of problem solving. As new issues arise, that you have that skill and confidence to be able to manage those. How do you make effective decisions around your treatment? What resources, recognising, as I said, there's a lot of resources available. How do you find out about what's available? How do you identify the resources that are going to be most valuable? That's an important part of being an effective self-manager. You need to be an effective communicator. And that goes across, it's often we avoid communicating or asking people for help or asking the right questions. And so it's about developing those communication skills with your family, employers, and your healthcare provider, so that you're confident when you go to some of those health appointments. and then action planning, as I said, kind of making that list and deciding what you need to do. So the Optimal program is a self-management program it's a 6-week program. People come once a week for 6 weeks, and it's really divided into 2 halves. The first half is very much kind of education and group discussion around a number of the general topics that I've already spoken to you about. It's a multidisciplinary program, so we have input from physios, pharmacists, dietitians and occupational therapists. And the second half of the program of each week is around goal setting. So it's that action planning. So it's an opportunity for people to go away and to trial some of the strategies that we cover in the program each week, because that's the only way really you're going to know, do these things work for me, or how do I tweak them in order to make them applicable and workable. So we can give information, but what we need is for you to actually try things, and that's the way really that we start to make changes in our day-to-day routine, is if we've had an opportunity to trial them. So just to kind of quickly go through the program, as I say, the first week is very much an introduction. The second week we talk about fatigue management. So again, just different ways of managing fatigue and how to recognize fatigue. The third week we have a physiotherapist who talks about the benefits of exercise and different types of exercise options, and really talk about, again, kind of the minimum level of exercise and the national guidelines around physical activity. The fourth week looks at stress management and the impact really of stress on your physical health, and again, strategies around managing that. The fifth week then we have a pharmacist talk about a medication and ways of managing. If you're on multiple medicines, it can become confusing, and just ways, again, it's important that people maintain that they stick to taking their medication. So this would be just strategies around making sure you do that. And then the final week then is around developing effective communication strategies. So we did a study really because everybody wants to look at what is the evidence. You know, the program sounds great, but is there actual evidence that it works? So we've just finished a study looking at comparing it, delivering the program to people with different types of cancer. So it wasn't specific to one type. So we could see how transferable it was across different people with different cancers. We ran it through the oncology department in St. James's Hospital, and we had really people over the age of 18 right up to 80, and had completed their cancer between 3 months and 2 years. And then we had people, we really needed people who were going to be able to participate and actively participate, because the discussion component of the program is really important. So we had to make sure that we did have people who could actively participate in the program. So the findings we looked at, did the program make a difference in terms of people's activity level? Did it make a difference in terms of their self-confidence around managing their diseases? Did it make a difference in terms of their mental health? And what we found was that there was improvements for the people who got the program over the people who didn't get the program. So basically, both groups made improvements, but the people who came to the Optimum program made more improvements, made a greater level of improvement. And there were actually significant differences between the people who came to the Optimal program and those who didn't, in terms of anxiety and quality of life. So I suppose we were very pleased with that, because again, they're the areas that people really identify as being neglected, if you like, in the last 10 to 15 years in the whole kind of cancer world. So that was a really important finding. I'm not going to read through all of these, because again, I think we're getting very close to lunch. But I think what really people talked about was they had a different attitude towards their symptoms, a different attitude around how to manage them, that whole idea of not being as hard on yourself, not pushing yourself, that's not always the best way to manage. A lot of people talked about, and you'll find this in the literature, that when people are finished their cancer, they feel different. It's a new normal. And that coming to the programme and meeting other people in the same position helped them to kind of make that transition. I think the strongest thing that came out, and you've probably noticed that, through the OVACARE, is just meeting other people in similar position. What the people have said, you go to outpatients, you go for your appointments, you're sitting beside people that are going through the same thing, but you don't actually get a chance to talk to them. And coming to the programme gave them that opportunity, gave them a chance to kind of talk to somebody that they knew understood their symptoms, that was going through something similar. And also this idea of like a safe environment to talk about difficulties. Again, feeling guilty, not wanting to talk to family all the time and overburdening family. So that was very much coming through in the interviews. And again, this whole idea of managing, and that, this that I thought I was the only person having those difficulties. So the whole validation, this is actually quite normal. A lot of people feel tired. A lot of people feel stressed. It's a normal reaction to what I've been through. The goal setting, again, that was important. Every week people would set goals around what they'd like to achieve the following week. And again, it's that, Deirdre referred to it, that idea of I might do 5 minutes of a walk today and then increasing that incrementally. And people found that the goal setting helped them to do that, helped them to get back and do the things that they've been wanting to do since the cancer, but just didn't have the motivation, and that this goal setting helped to do that. And also just listening to other people and the goals they were setting, that sometimes people felt, geez, I'm actually not as bad as that person. I can do this. And that was a good source of motivation as well. We wanted to find out, I suppose, about the timing of the programme. When was the best time that would have the most benefit? And we kind of got a lot of variation, so we haven't answered that question yet. Some people would have liked it kind of about 3 months after treatment. Some people talked about they needed a bit of time, to kind of get over the treatment, and therefore 6 months was a good time. Some people felt that, 12 months is good because I've got back into my routine, but then I'm finding I still have difficulty. So, as I say, we didn't get the answer to that one. And maybe it's about having programs at different times for to kind of really, if you're talking about kind of responding to people's needs, having the programme available at different time frames. And it's actually nice mixing people as well who maybe are further along since their treatment. I think that can be really helpful to people who've just finished treatment as well. And again, that's where the discussion and the time for people to kind of, over the tea and the coffee break in the middle, could have a chance to kind of share their experiences. So what have we found, I suppose, what have we learned? Again, that people kind of post-treatment, cancer survivors as the terminology used now, is that, people do continue to have difficulties. It's not like treatment finishes, I'm fine. There was a lot of people talking about the lack of support and the services, and again, I think that really is on the agenda. I was at the Irish Cancer Society there about 2 weeks ago. Had a full day meeting around, where should their research go, what should they be focusing on, and the whole idea of supports after treatment was very strongly coming out from all, and they had academics, they had kind of the groups like yourselves, OVACARE, they had clinicians, they had researchers, they had, so again, that was kind of a common theme coming across from all groups, which hopefully now they'll act on that. Again, the Optimal programme is an opportunity for people to validate their symptoms. that self-management is clearly a need for people at different times, and so it's about kind of responding to that variation. And we also, as part of this study, and it's all right, I don't have more slides, so I'm not going to go into it. There are some people that the kind of group self-management programs they don't like that. They don't like coming to a group. It doesn't suit those people. So what we did do is, well, we interviewed those people to find out, well, how would you like to get that information? So again, that'll inform some of the research going forward to see how can we address the different kind of post-cancer treatment needs of those group of people that this format doesn't suit. So that's it. You'll be glad to know. Thank you. Thank you very much.